Proposal by the National Hospital Insurance Fund NHIF to reduce benefits in the $3 billion cost-saving plan has received sharp criticism from doctors. The Kenya Renal Association now says the move will have a negative impact on over 5,000 kidney patients on dialysis. They want the NHIF to consult widely and seek other alternatives for raising funds. The NHIF CEO Dr. Kamunyo says the proposal is still in its early stages before its implementation. Francis Mtalaki reports from Mombasa.
In the new proposal, renal dialysis, major surgeries and diagnosis tests such as MRI and CT scans top the list of benefits that the National Hospital Insurance Fund NHIF aims to cut in a drive to reduce payouts. The move has received sharp criticism from the Kenya Renal Association.
I'm worried as to what is going to happen to our patients. 5 years ago, the number of patients undergoing hemodialysis in this country was less than 500. And the reason for that is that out-of-pocket expenditure for this is unachievable.
On dialysis, and now we have over 5,000 patients on dialysis, and we have over 200 dialysis units in the country. This has gone a long way into increasing access. In the past, a lot of patients were dying because they didn't have access to dialysis.
If approved, the state-backed insurance cost-cutting drive will reduce payouts to hospitals by at least 2.9 billion shillings in the year to June 2022, forcing thousands of beneficiaries to top up their medical bills. Kidney specialists meeting in Mombasa say that over 5,000 patients on dialysis might succumb because of their inability to cater for the services.
But the first step would have been to consult, because now we have very many dialysis units distributed throughout the country.
Who are being paid by NHIF to do dialysis have played an enormous part in saving government costs for human resource.
NHIF CEO Dr. Kamunyo says there's nothing to worry about as the proposal is still in early stages and it will be subjected to consultation before implementation.
The aim for us is not to reduce benefits. In fact, what we want to achieve is that our members have the benefits that they need without spending. And that is why the contracts that we're having and introducing in the new contracting cycle will be two. That is the comprehensive contracts, whereby with the members, they will be able to walk in and walk out without paying a single shilling. And then the non-comprehensive ones, whereby if a member chooses to go to a facility like that, would pay a top-up because of the choice.
Doctors say NHIF should find other mechanism of increasing collections as well as deal with corruption rather than reduce payouts. Maximum cover for MRI scan will be reduced from 9,600 from the current 15,000 shillings per session, while settlement of CT scans is said to be capped at 6,000 shillings from 8,000 shillings. The average payout for renal dialysis will fall from 6,000 shillings from the current 9,500 shillings. If the proposal are approved, hurting kidney patients as NHIF seeks to reduce bills for the weekly procedure by 1 billion shillings annually to 2.7 billion shillings.
If you look at the reimbursement, actually, like for the renal dialysis, we've increased the sessions to 3. So at the end of the day, the reimbursement, if it's to a facility, it actually works out to the same.
But benefits for cancer patients are to be increased as the country battles the rising cases of the deadly disease. Average payout for PET scan used to diagnose ailments like cancer will increase to 40,000 shillings from 32,320, while for the basic chemotherapy will be increased to 25,000 shillings from the current 17,062 shillings.
But we want to ensure that we have as many comprehensive facilities. And to do this, we are talking to the providers as well and showing. In fact, some of the proposals there is actually to even increase the rebate in those facilities.
Payouts for complex chemotherapy will be capped at 100,000 shillings from 72,852, with an average radiotherapy claim set at 72,000 shillings from the current 61,224 shillings. Francis Mtalaki, Citizen TV, Mombasa.